Most people nowadays are suffering from a psychological problem which may be called COVID phobia. All people, regardless of sex and age, seems to be under its grip. Is COVID really to be feared that much? Most people who contract COVID escape with minor symptoms, and some have no symptoms at all. Among the infected people, death rate is only around 5%. As it stands now, there is no vaccine and there is no proper medical treatment. If you have serious breathing difficulty and if you go to the hospital, you will be given oxygen or you may be put in a ventilator. Many people think that this is treatment. This is not treatment. This is symptomatic relief. If you feel very bad because you don't get oxygen, and if you are put in a ventilator, you will feel relief. But whether it helps in the cure of the disease is open to question. It is even possible that giving oxygen artificially may decrease the body's natural defense and the capacity of the body to get out of the infection by its own effort. But of course, I am not saying that you should not take the ventilator if you have too much of breathing problem, but it may not be any treatment. And some people are given blood plasma of cured patients. This again is no definite treatment. The blood plasma of a patient who has been cured of the disease may contain antibodies, and this may help, but there is no guarantee and this is no assured treatment. So my whole question is, should you rush to the hospital? Most people in India have too much of inertia in their personality makeup, and they have got a great deal of dependence. They want to go to the hospital and somebody must take care of you. But in many other countries where people are independent and people take very rational decisions, most people self-quarantine at home. A long time ago in our country, we used to have dreadful diseases like cholera and smallpox. Every year during summer, there used to be a great deal of smallpox infection. And what used to happen those days, if a person catches smallpox, he would be isolated in a room in the house, and other members of the family would avoid going to that room. One person would bring food, place it on the table and go away, and the patient will get up, take the food, wash the plates and go back to bed by himself. And some people may get a cure, some people may die. And there are professional people who would come and take the body and dispose it. That used to be the case. The Prime Minister of England, when he got COVID, did not go to the hospital. He remained at home. And finally, when he had serious breathing difficulty only, he went to the hospital. So, if you go to the hospital, there are many risks. In the first place, you will spread the infection. Somebody has to take you to the hospital, and in the hospital you will contract health workers, nurses and doctors and other people. And the hospital is a public place where many people come for various ailments. And the health workers who attend on you will spread the illness when they go home. So, if you have COVID, consider isolating yourself at home so that you don't spread it unnecessarily. Of course, I am not saying that you should not go to the hospital if you have any serious problem. So ultimately, what is the solution to this problem? We may have a vaccine, and there is no guarantee that the vaccine will help. Of course, we eradicated smallpox and cholera when the vaccines came, but there is no guarantee that we will discover a vaccine which is effective for all strains of the coronavirus. So ultimately, it is a question of developing herd immunity, and herd immunity comes when roughly 70% of the people are immune to this virus. And then the virus cannot spread rapidly, and then it gradually dies out. So, we come back to the point of immunity. So, how to develop immunity is the main solution to the problem of COVID or any other virus infection which is spreading as a pandemic. If you are healthy, your immune system will be very efficient. And if you want to be healthy, you must be mentally sound, because the body and mind are related. There is the psychosomatic relationship. If you are afraid, if you are having phobic reactions to COVID, that will weaken your immunological system. And the immunological system can be underactive, it can be overactive. Underactive immunological system is certainly not good. Overactive immunological system is also bad. If your immunological system is overactive, it is called a cytokine storm. That also can create serious problems. See, many COVID patients get blood clots, which may go to the brain and produce stroke. And this is supposed to be one reaction to an overreaction of the immunological system to the COVID infection. So you can die of an overactive immunological system. So why is some people's immunological system is overactive? It certainly has something to do with your mental condition. If you are terribly afraid of something, then your entire system will overreact. So think of how you consider the whole problem. Are you afraid of it, or do you have enough courage to face the possible infection of this virus? And you must find out what keeps you healthy. If you are an old man, you may require possible human interaction to keep your mental balance and to remain happy. If you shut yourself up in your house all the time, that is going to increase your depression. That is going to bring down your general health, and with that the immunological system will also function improperly. So, enclosing yourself at home all the time is not the best solution for COVID.
വിമൻ ടോക്ക് ടൈം എന്ന ഈ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുക, ആസ്വദിക്കുക.